The pre-implantation genetic diagnosis is actually one of the biggest advancements that genetic science has contributed to assisted conception. As the name suggests, it's pre-implantation. The process involves creating an embryo first, and for the scientists to remove some bit of the cell in a day 5 embryo, and taking that under very clean and sterile condition to be analyzed to look to see whether that embryo is genetically normal. Okay, it sounds very simple, but there's a lot of counseling involved in this, and I think every couple should be aware that as we do pre-implantation genetic diagnosis, there may be a chance that amongst the embryos that are created, you may have no normal embryos to be transferred. Likewise, it may also give you an idea which is the normal ones that you have, and potentially increase the chance of a normal healthy baby. The genetic analysis that we do allow us to look at the entire chromosome range. So we'll very likely choose the genetically normal embryo. For example, like a 46XX, which means it's a normal girl, or 46XY, which is a normal boy, to go in. There are certain conditions like hemophilia, which is a sex-linked disease. And for those couples that don't want that disease to be transmitted into their offspring, we can in theory choose the female to go in. Pre-implantation genetic diagnosis or screening, alright, has two potential main indications for use. Number one, if you are a couple that already know that you have a genetic condition that potentially can pass on to your next generation, then of course you can use this technology to diagnose the embryo before you go in. The next big group of patients is women who have undergone many IVF cycles but has recurrent implantation failures. We don't know the reason. And of course, we know that genetics play a big role in everything. And studies have shown that by looking at such embryos from these women, we may be able to find out why these embryos don't stick. And most of the time it's because of genetic deformities. You have an entire set of embryos that are completely off, completely abnormal. Then the couple may have to consider options like donor eggs as their next choice to have a baby of their own.